Joel Cohen, and we're here at Maui Derm, where I discussed injectables, fillers, Kybella, as well as neuromodulators. Starting with fillers, we discussed some of the ways that you can prep the skin, from using alcohol to iodine to some of the discussion of late about chlorhexidine and even the use of hypochlorous acid and chlorxylenol. So it's important that we do prep the skin, we remove makeup, and we make sure that there is nothing in the area or the field where we're going to inject. Secondly, in terms of understanding the things that can go wrong, we discussed some of the recent literature about some of the delayed nodules that form and how to approach these. If they're red, if they're hot, tender, and feel fluctuant, and how to actually take a culture and order a delayed culture so that they may actually be able to pick up mycobacterium. We talked about some of the ways to treat impending necrosis, from hyaluronidase injections along the distribution of the area that seems to be undergoing some discoloration, as well as oftentimes pain, and some of the controversy about nitroglycerin, but nevertheless many people use it. So hyaluronidase, nitro-paste, and then thinking about other things that have been described in the literature, from injections of low molecular weight heparin to injections of IV prostaglandin E, to even considering things like hyperbaric oxygen. As far as blindness, there's been some important articles that have taken place, from Katie Belesny and Jean Carruthers' article about the almost 100 cases of blindness that have occurred worldwide, and some of the areas on the face that have been associated with this, which is really many different areas, really understanding the anastomoses of these vessels and how vessels sometimes don't follow the course or the pattern that's been described in many of the anatomic books, but they may have aberrant courses, such as the angular artery may actually split off before and go towards the area of the infraorbital artery and not necessarily along the nasofacial sulcus. So understanding some of the options that are available if you do have a patient who may be unfortunately experiencing visual impairment after a filler, from Greg Goodman's approach in dermatologic surgery, where he palpates the supraorbital notch and places hyaluronidase right into that area in the hope that it'll actually progress back to the ophthalmic artery and the central retinal artery, to the other descriptions that Jean Carruthers and Steve Fagan have published on, in terms of retrobulbar injections, pulling the eyelid down, injecting the needle all the way under the eye, along the infraorbital bone, into the area where you're putting hyaluronidase very, very deep in close proximity to the central retinal artery. So I think there's a lot of excitement about injectables at this point: fillers, injectable submental fullness, Kybella, as well as neuromodulators, and we discussed some of the things that are going to be important for our practice in 2017. Thanks so much for joining us for DermTube at Maui Derm.